Every person is unique, and I try to take into account their ancestral heritage of where the person's parents or grandparents were raised and what types of foods matched their their residence. And looking back in that perspective is one thing that I try to do with people. But I would say, generally speaking, it's the quality of food that I try to stress with people. Besides their instincts of what they find attractive, what foods they find attractive, I try to help them to realize that the little added, not sometimes not so little, the added cost of eating high quality foods is part of what's going to help them to recover their health. But the most influential book on nutrition was a compilation of the work and research and studies of a Dr. Weston Price, who was a dentist at the turn of the 18th to the 1800s, 1900s, and he recognized that the dental health of the children of his first clients was much inferior in terms of cavities and the narrowing of the dental arch and the crowding of teeth, and he felt that possibly one cause of that might be the introduction of industrialized foods of Kellogg's and Nabisco, etc., back around that time. So he wanted to see if that was true and traveled to different parts of the world, to Europe and the Arctic and to the South Pacific, to find populations which were still isolated, which were still eating foods from their own environment. And he found them to be extremely healthy, not only dental wise, but the health of their physical body and their mental health. And then he also took samples of their food and had them analyzed for nutrient content, etc., and found them also very high. And then he and his wife traveled back every 10 years and watched reassess the people's health as they were introduced to manufactured industrialized foods brought in by traders and the missions, etc., and found that people's health was obviously declining, especially the offspring of the parents who had been consuming these manufactured fortified foods. And so it was a really wonderful study without a lot of variables. And now we have very inferior quality foods, and we're dealing with environmental toxins, which Price was not dealing with the introduction of toxins during that time. So it's really a simple, straightforward examination of the influence that the quality of nutrition has upon our health. And, there's so many different approaches these days with so many, cookbooks and different approaches, high protein diets, etc., that people are very confused about what's best for them. And again, I encourage them to use their instincts. And the body, unless a person is really, really sick, their body still gives, still communicates, gives signals on how it feels after eating certain foods. The person may have to sort of be on a very hypoallergenic diet, or maybe nothing but low glycemic juices for 2 days or 3 days, just to have a sense of a foundation of feeling okay. And then introducing foods or a nutritional program, and they usually know if they're faltering and not feeling well after a certain type of food. And so using the body as a sort of an experimental tool to see how it responds to foods is one approach. The other thing which I think we're seeing so much of these days is even people on really high nutrient dense, good quality foods are still having gut issues. And this has to do with the environment, the ecology of the gut, which has been so insulted by various medications, antibiotics and pain medication over the counter, and also by having been on in the past foods which have a lot of preservatives and other chemicals in them. These residues stay in the gut and causes real problems with digestion. People are very stressed out. They're worried about the food they eat. Is it good enough, whatever? And then they have that stress, and the system in the stomach is not producing the enzymes that are required to digest and break down food so it can be assimilated. So the gut is also a really, really important part of helping people to recover their health. That environment of the gut, this tube that runs all the way through us, has sometimes more of an impact upon our health than the environment outside of our bodies. So this is an important area to focus therapy to begin to recolonize the intestines with good bacteria. I prefer the category of soil bacterial probiotics to initiate with people, to get onto a hypoallergenic diet, to maybe take some enzymes for a while, to investigate what is called leaky gut or permeable gut, to look at if there's bacteria in the gut, to take certain supplements to help this innate wisdom to eradicate or to eliminate or to reduce the high population of unbeneficial bacteria flora in the gut. So that's the attitude I have about nutrition, is primarily eating high quality, nutrient dense foods to make sure the person is digesting those foods and helping with assimilation by improving the ecology of the gut itself.